This week, our health campaign is focused on oral health, and statistics show that an alarming number of adults and children are not heeding the warnings of doctors living with untreated dental disease that can lead to many more complicated problems. In a nationwide study, the American Dental Association found that almost 50% of lower-income families haven't been to the dentist in over a year. That's true of 30% of families in the middle and high-income brackets. And take a look at this next study. The CDC, Centers for Disease Control, found that 50% of adults over the age of 30 have some form of gum disease. And when it comes to the kids, not good news either. In this study, 1 in 4 kids already had cavities as young as 5 years old, and even younger, toddlers. Joining us with more in our studio, we want to welcome Dr. Lawrence Musser of Florida Dental Implants and Oral Surgery. Thank you for coming in.
Thank you for inviting me.
I'm most surprised to hear about the kids being affected at such a young age. How do you feel about that?
It's amazing. I see teenagers that have periodontal disease, and no one has really taught them how to brush their teeth or floss. So the best thing for your children is to go to a children's dentist. And if you start that early, then they're very comfortable. And the kids that I see that have been to the pedodontist, they have no tooth decay, they've had their teeth sealed.
When they're not going, and what about the fruit juices? How does that work?
Fruit juices, anything with sugar or phosphoric acid. Actually, even Gatorade is probably the worst because of the sugar content. So that can cause decay and lead to periodontal disease.
You were at the Dr. Oz event, and you talked about why people need to, adults, why we really need to take the issue of oral health very seriously. And you gave the example of blood and football. Can you share that with our viewers?
Well, that was a great event, and I enjoyed being on a panel with Dr. Oz. Of course, being around him, he's such a great person, great doctor.
And you gave the example about what happens in the blood and how.
Right. If you're flossing your teeth and there's bleeding, or if you're brushing your teeth and there's bleeding, then you have oral disease, you have periodontal disease. And those blood vessels are actually open. And the bad bacteria, the pathogens that live in between your teeth, actually have access to those blood vessels. And then when they get in the blood vessels, they run through the arteries. And it's just like having the Tampa Bay Buccaneers run through your arteries with their cleats on.
Very dirty.
They're very
That's
dirty.
Not good.
They do a lot of damage, and your body patches that damage with cholesterol. And you hear about the good and bad cholesterol. The LDL is the bad. Dr. Oz calls it the lousy cholesterol.
The lousy, he's so funny.
And that's so easy to remember.
A fascinating conversation that we will continue on Facebook, so thanks for joining us.
Great.
But for now, we're out of time. Back to you on the set.